Okay, so now as you can see here, there's a nice even space between the upper anteriors and the lower anteriors. It's nice even, about 1 millimeter space. When we go into protrusion, you can see how the two centrals contact the lower two centrals, and they're also lined up evenly with the midline. The other thing is that you can see these are nice and straight up. They're not flared too lingually or flared too buccally. And the other thing is that there's a nice curvature in it, or a nice level occlusal plane, and it follows. You can see it's supposed to follow back to that. Another way to check is you can line up with your dots in the back and just kind of see and make sure that everything basically lines up nice and evenly. Okay, so now what I was talking about before was these spaces here, because we had set that first. Don't be too alarmed if there's a huge space. This looks a little big. If you were to set it straight up, you'd have a gap on both sides. But so what we can kind of do is we can kind of tweak it. You just find a happy medium and just tweak it a little bit so it sits kind of off center. This side won't be so bad because the gap is not as big, and we can set this tooth a little better. So we're going to get this set up, and we want these things to flow. We want it to flow, the cusp tips to flow from here, to here. And then that's why we move these out of occlusion, because then we're going to bring these down to contact those in the end. So we set them the same way as we do all the other teeth. You want to clean off any excess wax before, because that tends to stay hard and could block you from setting the tooth right. And then just go ahead and heat up the wax and add the teeth as you normally would. Again, another thing to think about when you're setting these is following the curvature of the arch. So make sure your cusp tip follows the nice curvature. It's not pushed out like this or pushed in too far.